People going to the emergency room when they don't have an emergency. One West Michigan hospital has now come up with a new way to deal with this problem, and it could save taxpayers millions of dollars. 24 Hour News 8's Danny Carlson's live with a story you'll only see right here. Danny?
Brian, the Center for Integrative Medicine doesn't officially open until next month, but 24 Hour News 8 got a first look at it today. You can see it actually just right behind those walls. So why do we need something like this? Well, basically, Spectrum Health found out that the same 1,000 people visit the emergency room 20,000 times each year, costing up to $50 million.
The vast majority of these patients, in fact, I still haven't found one that wanted to do this on purpose.
This is Spectrum Health's new solution to those who use the ER a lot, meaning they go 10 or more times a year. It's the first in the state, the Center for Integrative Medicine, a space for those overusers to treat underlying problems and hopefully cut back on ER visits.
It's not that if you come to the ER 10 or 15 or 20 times a year, you're just automatically crazy.
No, in fact, we found quite the opposite.
The director of the new center, Dr. R. Corey Waller, says the complaint they see the most in frequent ER users is pain. But it's hard to figure out what the cause of that pain is in a short visit to the ER.
There is a federal law that states that in the emergency department, you see whoever walks in the door and you adequately treat their condition. The hard part is figuring out the accuracy of their condition in the emergency department when they're not severely ill.
The new center will see about 800 patients in its first year. On the first visit, patients will get both physical and psychological treatment, then take that treatment plan to a primary care doctor. In the first study Waller did, a group of 30 frequent users cut their visits by 85%, saving about $1 million.
Somebody who doesn't require all of this, that's great. But at the same time, if we don't do this, their rates are going to continue to go up on their health care.
For those of us who don't use the emergency room a lot, basically, why should we care about this? Well, if this does work and other hospitals across the state start using a similar plan and have similar results, it could save hundreds of millions of dollars each year. And we found out tonight many of these frequent users have Medicare or Medicaid, which means it could end up saving taxpayers a lot too. Live in Grand Rapids tonight, Danny Carlson, 24 Hour News 8.